Mosquitoes, the bane of mankind. Their wings hum annoyingly, their bites itch, and did you know that they can also spread diseases? One of these diseases is dengue, a vector-borne disease caused by a virus, aka Dengue, of which there are four types. As there are about 390 million dengue cases in the world each year, dengue research is important to limit and treat it. For example, studying dengue pathogenesis helps scientists develop better treatments and diagnose dengue earlier, whereas dengue viral genetic studies help identify viral genome changes, allowing scientists to monitor its spread.
Dengue is widely spread in tropical regions with high urban population, temperature, humidity, and spatial variation in rainfall. More than 100 countries suffer from dengue, with the most affected areas being Southeast Asian, the Americas, and Western Pacific regions. The largest number of dengue cases worldwide was reported last year. 75% of cases occur in Southeast Asia, where epidemics flare up every 3 to 5 years. The first outbreak of dengue in Malaysia was in 1902. This chart shows the trend of dengue cases in Malaysia over the years. Today, increases in urban population, lack of solid waste management, and modern transportation have also increased the spread of dengue. The symptoms for dengue are a severe headache with high fever, eye pain, muscle and joint pain, nausea, vomiting, and swollen glands that commonly disappear within a week. A severe dengue, as known as dengue hemorrhagic fever or DHF, indicates warning signs such as severe abdominal pain, bleeding gums, fatigue, and vomit with blood, resulting in lung fluid accumulation, respiratory distress, and organ impairment. These signs are little, thus close monitoring should be performed during the critical phase. Dengue shock syndrome or DSS can also occur if the condition of a patient gets worse than DHF.
Looking at the modes of transmission of dengue, it cannot be spread directly from human to human. Instead, its main vector is the female Aedes aegypti mosquito and sometimes other Aedes mosquitoes as well. The female mosquitoes bite humans for blood meals to produce their eggs. If they suck the blood of an infected human, the virus passes on to the mosquito and spreads to their salivary glands. When this infected mosquito bites another human, they inject their saliva to prevent blood clotting and ease feeding, resulting in the virus entering the human bloodstream. Thus, the spread continues in this cycle. Other rare methods of dengue transmission include mother to fetus, mother's breast milk to infant, or through medical accidents.
When a female Aedes aegypti feeds, her proboscis penetrate through epidermis, dermis, and hypodermis to reach the bloodstream, leaving some dengue spill over in the dermis and epidermis. Dengue infects immune cells, first targeting dendritic cells in the epidermis layer, such as the immature Langerhans cells and keratinocytes that are less resistant to the virus infection. Dengue is an envelope virus. It infects the immune cells by attachment, receptor-mediated endocytosis, followed by acidification to release the nucleocapsid, which then releases the viral RNA. This RNA hijacks the host replication mechanism to make copies of itself, then uses the host translation mechanism to make viral proteins, which are then assembled in the endoplasmic reticulum and ready to be released from the cell for viral amplification. The infected immune cells will migrate from the epidermis layer to the regional lymph nodes, where the target cells of dengue such as monocytes and macrophages are recruited. The infected cells will release cytokines and cause dengue fever. The virus first replicates locally and later spreads to the bloodstream. In some cases, plasma leakage from blood vessels leads to DHF, with DSS in the most severe cases.
In the modern era, there are many diagnostic methods available with varying degrees of selectivity and specificity. One of these methods involves serologic tests, which look for antibodies and antigens in the blood. Among these tests is the Igm Antibody Test, or the Igm Antibody Capture Enzyme-Linked Immunoabsorbent Assay, MAC ELISA. This test is crucial for the acute phase detection of a primary infection because that is when there will be an exponential rise in the levels of Igm antibodies. In areas with a low risk of other cross-reactive flaviviruses, high levels of Igm are indicative of dengue. Unfortunately, although the Igm antibody test is useful, it's not very selective. In cases where non-specific reactivity leads to false positive Igm antibody results, the plaque reduction neutralization test, PRNT, is used to resolve any misinterpreted data. This test has been widely used to quantify the levels of anti-DNV neutralizing antibodies produced after an initial viral infection. As the name suggests, this antibody neutralizes virions and prevents them from infecting healthy cells. Previous diagnostic methods lean towards primary infection, while methods such as the detection of antigens in the serum, specifically non-structural protein 1, NS1, is more towards secondary infections. NES1 is a glycoprotein produced by the dengue flavivirus and secreted by infected cells even during the acute phase. Thus, early detection is made possible with the use of modern antigen capture ELISAs and dot plot assays.
Physical, biological, and chemical controls are the three major categories of dengue prevention. Determining and eliminating the oviposition sites of mosquitoes is a common method of physical control, along with promoting awareness in the general public to keep their surroundings clean, especially pots and jars that have unattended water. For biological control, sterile insect technique is commonly used, involving the release of laboratory sterilized male vectors in the target population, which suppresses the fecundity rate in female mosquitoes. For decades, insecticides have been used in prevention control, with insect growth regulators used to hinder the growth and development in insects during the early stages of development. As there are no commercially licensed vaccines for dengue yet, treatment focuses on using pain reliever and other medicines to quell symptoms. With the dengue human infection model, it serves as a promising research tool for the development of vaccines.
In conclusion, dengue is a vector-borne disease caused by dengue and spread by the bite of a female Aedes aegypti mosquito. It is widely spread in tropical areas around the globe, affecting more than 100 countries. Dengue has flu-like symptoms and the virus affects the immune cells, later on resulting in dengue fever. For diagnosis, the Igm test used in combination with PRNT is the best diagnosis method for most cases. SIT and IGRs, among others, have been known to be effective dengue prevention methods.